Well, hello there. Look at that. We got some add-on. How are you guys? Oh, look at that. Great. Good morning.
Good morning.
Good morning.
How is everyone?
Good.
Good. Excellent. Good. Well, we were thinking, now that we got a few people on here, we were thinking of maybe going through some questions on the lower extremity muscles that Vinny brought up to sort of solidify that material before the exam comes in, if that's okay with you guys. Any thoughts on that? You all the other participants?
That sounds good.
Sounds all right. All right, just want to make sure. And then I have to talk about the pathology groups, which I messed up a little bit. That project, but that's a small one, and then we'll start with next week. How are you guys all doing with the material? How is now that we're getting into the exam week? Are you guys all right? Overwhelming? A lot? Manageable?
It's good.
Okay, good. Well, I was just telling Winnie, I sent out the text with these two last drills. I'm sorry, last week I was a little overworked before the weeks before on the editing. Just takes a lot of time, but you know, some of that might be good to check the video and see if it's helpful to do before you take the test, sort of as a final go through, because I touch on some of the points and I talk a little bit about it for a few minutes, and sort of, if you know, just to sort of see if that helps you a little more to feel as familiar as possible with all the new terminology that we're trying to understand. Anybody would like to have any questions with the muscles up in the hip, the ones that turn the foot out, the lateral rotator group, the piriformis was one, and then we had the glutes. So you guys okay with the layers of the glutes? The maximus, the medius, and the minimus is not really the biggest thing for us in this discussion. And then we went into the TFL over here. So you all, if you have questions about these, you stop me and we'll talk about them. But we went then into the TFL. So these are sort of the muscles that bring the leg to the outside or also to the back, extended. And then from there, where we went into the flexors, the muscles that raise the thigh up, the psoas and the iliacus, the iliopsoas. And if that's all good, we're all good, huh? And then then we get to the knee. And in the knee, we have, actually, we have one back up in the hip. Those muscles are in the thigh area, the adductors that are the ones that bring the thigh back towards the midline. And those are nice because the name is right there for most of those. And then within the knee motion, we pretty much look at the hamstrings that flex the knee, that bend it. They are in the back, obviously. You'll always look at the bony attachments and then figure out if this thing shortens, what motion would you create. And then on the opposite side in the front, we got the quads, and those extend the leg or the knee. Well, actually, properly, that is the leg, because in anatomy, this up here is the thigh, and the one below the shin area, that's the leg, if you want to be accurate that way. Then we had this one, that's the sartorius. That's the last one here that sort of helps us. I think that's best understood by bringing the knee to the opposite, you know, crossing over the knee over the thigh. That sort of tailor motion in the old days, how they would sit. And again, the other thing why I like this muscle is it shows nicely how a superficial muscle guides the motion. There's a lot of motion happening, but it sort of leads, guiding the motion, and the other muscles support all the weight of the thigh and all that. The sartorius couldn't hold that up. That's too much. And now then we're getting more into what we're talking about with Winnie here, or with all of us, I'm sure. But what you brought up, the top layer of the calf, the leg muscles, in the leg muscles are like, I structure them as three compartments in the deeper level. And then the superficial one is one in the back. That's the gastrocnemius and the soleus on the bottom, or deeper to that. And those are anchor into the Achilles tendon. And those are very, very powerful muscle because they push us off the ground when we toe off. And so those are part of the anti-gravity muscles still, that are part of the gastroc, soleus, and then in the front are the quads, and then we got the glutes. Those are the ones that make sure we can stand up. Those are the ones you're working with, the squatting sort of motions. And then below that, when we take that off, then we go deep. And when we go deep, then we have 3 compartments that I look at. We have one in the front, the anterior compartment. We have one on the side, the lateral compartment, and we have one in the back, the posterior compartment. The one in the back and the one in the front are structured quite similarly. In each of them, we have a muscle that's called tibialis, because it comes from the tibia, sort of originates mostly in the tibia. And then we got muscles called hallucis and digitorum. The digitorum goes to the digits. Those are your toes or fingers. And the hallux is in the hand. It's called the pollex. And in the foot, it's called the hallux. And so we have these 3 muscles in the front compartment and in the back compartment: a tibialis, a digitorum, and a hallucis. And that the digitorum and the hallucis tells you where the muscle's going. The tibialis tells you where it's coming from.
Okay.
But that's also maybe interesting because of the language a little bit. So when we differentiate, let's start with the back one, because the front and the back is the same, and then we finish up with the lateral one. So in the back one, the tibialis is called posterior because it's in the back. And so that one is nicely seen here in the middle, comes right off the tibia, which is sort of by the toe. This is a toe here, so this is a left leg. I believe here. Yeah, this is the left hand. This is the right. Let's go with this band here maybe. As we get deeper, it's the opposite. That's always something you have to be really, really careful about. And I should maybe even label it more in the booklets next time. Which side are you looking at? That's really, really a problem with these. They have no convention about how to show things. So the model, like sometimes the muscle model is the opposite as the bone model. It's like, really? You don't even work with us dyslexic people? And so be very, very careful about that confusion. At least I have to be, and I am always slow myself down, because when it comes to clinic, you got to kind of make sure you don't mess up when you go from face up to face down, my thing. And in surgery, they actually mark the places where they do surgery so they don't do the wrong side. They actually they mark it with the, marker. Anyway, we have let's go down here. So we have the tibialis posterior that comes off the tibia mainly and goes right sort of in the tarsal area. We had the carpals in the hand. Those are the ones going in here. Here we have the tibialis that goes more in that area, not quite to the toes to the front. So that more works sort of strongly on the ankle joint, doing this motion with the ankle, up and down with the ankle. And this is very important because some of those muscles really take over the work if you have a lot of problems in the foot, of stability problems. And so they get overpowered, and sometimes that makes them sore, clinically speaking. And then we have these 2 other ones. So we got these 2 that goes to the toes and to the big toe, the hallux. And so we got the flexor digitorum longus. The reason why it's a flexor, it's because it pushes the toes down, and that's flexion in the terminology. And so that's why it's flexor. And then we have longus because we also have a brevis, but we don't worry about the brevis. It's too detailed right now. The thing is, you want to, and I see that even at my level, you want to learn this stuff layered. I mean, I'm reviewing again the tests that I've reviewed 10 years ago to muscle tests to be really, really accurate, or as accurate as I can be. And the layers is interesting, even you just have to give yourself time to absorb this material. It's a lot of material. So if you're overwhelmed, don't be alone, okay? Unfortunately, we have to kind of overwhelm the system a little bit to get this into this brain stuff. Anyway, so we have that flexor digitorum. And the thing is, in the back, you have to be careful. The funky thing is, look at that. It runs where the big toe is until you think like, oh, that's the one that moves the big toe. No, it's not. It crosses over to the digits here. So that's a little bit of a danger zone. Be careful with that. Always, or it helps us understand the tale of always look where the thing is going. Don't just assume you see the belly. That's where it is. In a test, yeah, that's all right because we do regions. We have specific amount of muscles. But when you get deeper in the thinking, you follow the tendon. Where does it go? And then you have more of an understanding of what it does. And so then on the lateral side here, on the pinky toe side, we have the flexor hallucis longus, and that one crosses over and goes to the big toe. And so again, this is the confusion here. It's on the pinky side is the big toe.
Crossing over.
Okay. All right. So that make sure you be aware of that. And this is actually stuff, some of that I had it took me to chiropractic school, they're exposing it. And I tried to bring it together where I learned over the years what confused me to try that out as early as possible in your teaching. So at least you heard of it and it's somewhere in a system, even though it might not be clearly understood fully yet. This is a lot of material. All right. Be gentle with yourself. But this gives us the triad in the back. All right. That's pretty good. And then when we go to the front, and again, questions, interrupt me. Then when we go to the front, we got the same spiel. Now it's just the tibialis anterior instead of flexor. Now it's extensor because we bring the toes or the hallux up. But we still have a digitorum and we have a hallux over here. And so here it's a little bit easier because look, we look at the tibialis anterior, nice in the shin. And this is one that's huge in people that have ankle issues, like ankle stability issues, often very bulky here. Takes on a lot of work. Especially if the arch is dropped a little, pulls up that arch. Well, a little bit. And then we have the one, the hallux is this purple one. It goes right here. It's right in the middle. So it is where we want it to be. It feeds into the right position. Because look at the digitorum is right on the outside there and goes to the digits. And so that's the three in the front that we have. And then lastly is the lateral compartment and the outside compartment. Those muscles are the fibularis muscles. And so we have tibialis muscles. We think they're on by the tibia probably, and they mostly do. And then we got fibularis muscles, and those run by the fibula. The old name of those are peroneus. See down here, the word peroneus? That's a word that's still very widely used in books and on things. And I want to make sure you understand it because the new word is fibularis because it runs by the fibula. So that makes logical sense. But you still see that word a lot. And so make sure you AKA that because it's a totally different word. So we would think, at first I always thought like, oh, it's a different muscle. Where's that muscle? But it's the same muscle. So we have three of them technically, but for us, we really use it as one of them because they all do the same kind of function. They are attached out here on the fibula. So if you actually it's kind of behind the fibula. I don't know if my leg, man. If you're on the outside, it's on the underneath a little bit outside. So it's really on the outside of the fibula. And you can see it here. You just don't see the fibula because it's covered by the muscle and it reaches underneath the foot. That's the interesting part. This muscle reaches underneath the foot, the long part, the big part that's most interesting for us, and goes into the underside of the foot by the big toe. So that's like a long way. And if you can visualize you twisting an ankle, so this is here the muscle, and you visualize you twisting an ankle, and you flip that ankle down, you're going to stretch that muscle. And so often that muscle gets sore after somebody twists their ankle. But it also becomes the muscle that if you rehab the ankle properly and not just like, let's just leave it alone. and don't move anymore. And say like, you can't move anymore because your ankle is now twisted. Then this muscle becomes the protector for all these ligaments that are a little bit stretched over here if we twist the ankle a lot. And this is very helpful to protect us from re-injuring that again, if we have that muscle be very agile. And so that's why that muscle is a really, really crucial and important muscle. And I have patients, they come 15 years, 20 years later, and I test that muscle, and the brain never reintegrates the muscle in a movement pattern because it hurt at some point. And when you walk, it hurts. So the body says, oh, let's not use it. And then it doesn't reintegrate it. And then it's all of a sudden we work on it and we'll stimulate it that it chirps on. The brain works with it again. And boom, you have a lot of recovery of problems. It's very interesting. So this muscle is very cool. So it's attached on the fibula and on the reaches, well, the main one reaches underneath the foot, and it goes and attaches then, inserts on the medial part of the underside of the foot. Very cool muscle. One of my favorites. If you come in with a twisted ankle, I completely know what to do with this muscle. It's perfect. It's very easy to treat, really. And then the smaller one, the brevis and the tertius here, those are smaller ones. They start on the same bone, but they reach to the outside of the lateral part of the foot here, the metatarsal. So goes not underneath. But it does the same, helps the same motion, assists that motion as well. So those are really cool. All right. So is that helpful, or that's just a lot of
Yes, thank you. Yes.
Right.
There's a question in chat.
Oh, there is. Let me go. Yeah, I should do that. How do you strengthen that muscle? Which one? The peroneus? The fibularis? Okay. You balance. You do balancing exercise.
Mm-hmm. Yeah, lateral compartment.
All of them, actually. What I do, I got this pad. It's called the balance pad, and the foam doesn't compress. It's a little firm. When you stand on it, you have to balance a little bit, and it uses all those small muscles in the leg or everywhere, and that helps you build them. And what it really helps you builds the agility. It really helps create that chirpiness, that reactivity that you want when you walk, and all of a sudden the ground is uneven and you twist your ankle a little bit. Of course, if you have floppy ankles, I suggest to put on shoes that go over the ankle.
Oh, okay.
Yeah, that makes sense. Thank you.
That's
always, because I do have like twisted ankles, so I'm like wondering.
From a Swiss perspective, just don't go hiking.
Really?
Not shoes that cover your ankle. But every time I took friends or family from here over there, they always want to go hiking with tennis shoes. I'm like, really? Don't protect your ankles. Yeah, be mindful of that part, because the ankles is one of those, it can be, you really need your ankles to be as strong as possible. And it's not that much that it takes to hurt them. And so I don't want to be alarmist, but that's one of those places where I'm like, yeah, just if I don't use hiking shoes to go walk my dog, which go over the ankle, and I don't, I wear them quite loosely, but they still protect the ankle. I would have twisted my ankle so many times with my dog walking in the park, picking up balls and not seeing a hole or something, Just be mindful about that, that's all.
Yeah. It goes the same thing for running.
No. I mean, if you're running, and if you're track running, trail running, then I will go to the store and buy the trail running shoes, because those sometimes are a little bit higher. They don't cover the ankle, they go on the bottom of it.
Yeah. Okay. All right. Thank you.
Absolutely. And the balance pad standing that I told you about, or just explained, you can buy that at Amazon for like $25, and they don't sell these in high school soccer kids, that they had them stand on that thing for like, I think 5 minutes a day or something, instead of sitting down and watch TV. Nothing fancier than that. And they did not have twisted ankles when they were playing football and soccer. Now those are sports you can twist your ankle real easy with cleats. Think about it, you anchor something in the ground, that foot can twist over real fast. And that helps so much. So that's something that I tell all of my patients, get one of those pads in the house. You can kneel on it, you can stand on it, you can do your dishes on it. It helps you not get, sore feet when it's all the hard floor and barefoot. It's really a helpful tool. And orthopedically, that's shown is very helpful, that kind of thing. And it's the balance.
Yeah. Thank you, Dr. M. Yeah.
Oh, sorry, I'm taking off here.
No.
No,
We'll talk more in class.
Yeah. Oh, good.
Yeah.
Yes. We got class tonight. This one I messed up. Join the group. So I need you guys. I didn't make groups. I just made how many people in a group. Somehow I must have messed that up. So I want you guys to go back in and join again. I'm sorry. Because I don't
How
want
many people do you want in the group?
I don't want to have more than 3 people in a group.
Oh, wow.
And all of a sudden I got 12, and so I'm like, no, let's just redo it. And I found my mistake. That's why I came on the Zoom a little bit late. So if you go to people, let me see, can I actually make me be in a student view? Yeah, there we go. A little slow. If you go to people, bang. What I did now under groups, I did that third one, and then I can cancel all the other ones. Maybe I just did it. Oh, see, now you can see path project, and now there's 17 groups because we have 50 students. And so now I want you, and I'm going to delete all the other ones. I'm really sorry that you have to redo that. But what I want you to do is assign yourself to one of those groups of path project 1 through 17. And then there's enough room for all the people. So you can,
How many people should we be in one group?
Huh?
3, right?
Like how many
3.
people in one group? 3 or?
Yeah, 3. And you can't do more than 3. It doesn't let you do more than 3. Then it goes to the next. That's why when the first one was full, it didn't let you add more. And that was my bad. And so if you just redo that, and the reason why I want you guys to let you add on a little bit yourself is you can talk amongst each other if you have friends in class, or we meet tonight in class and you work with somebody already and you want to keep doing that. Then I want to give you a little room to do that. And then at the end, who didn't add on themselves, I just put them in and sort of randomly assign you to a group. And then, and so you go in the people groups, and now you can assign yourself to one of the groups. At least I hope. It should be that way. I haven't tested it yet. So if it still don't work, let me know. My bad. But I think it works. I think I found my oopsie. And so then we do that over the next little while, a few days, probably end of the week. And then once we're in a group, what I want you to do, now we're going to week 9. I want you to read this week 9 pathology project introduction. I want you to, within the group, start talking amongst each other and say, what kind of pathology would we like to talk about or research or do a little studying about? What are we interested in as a group? Or maybe one member has a strong affiliation as like a family member, interest themselves. It can be anything you were thinking of. It just has to do with the body, and it has to do with sort of disease. It could be anxiety, depression. It doesn't have to be physical that way, because to me, that all works together. That's always, of course, that's how I see it. So then I want you to come up with what you're researching, communicate that with me, and I think that's sort of the first prompt this week 9, or we're probably going to extend it a little bit to week 10, depending how fast we're moving, since I goofed up a little bit. But I got plenty of room in the schedule to balance that part out. And then once you have an idea, then I want you to, so we have 3 members, then I want you to think about 3 questions that each member will discuss or research about. Question number 1 is, what is the pathology? What is the disease? One person will research that stuff, and you go through like at least 5 sites. I would start with Wikipedia. I have found good stuff on Wikipedia. I know other teachers don't like it sometimes, but I want you to be getting good at internet research. That's very, very important because there's a lot of good information out there. A lot of crap, but we need to figure out what is what and how to differentiate. So I want you to use at least 5 different sites. Go to some .org sites like the Mayo Clinic and that kind of stuff, and figure out what's going on with this back pain, or what's going on with this anxiety, or what's going on with this diabetes and heart disease kind of stuff that you might find interesting. And then I want you to do a second person. I want to research what is conventional medicine going to do for you. And that's the regular. When you go to the doctor, when you go to the hospital, what are you going to get? And the reason why I started this project is because of question number 3. And the third person does question number 3. And question number 3 is, how can you, as a person, as a now very educated person in body stuff, I mean, once you go through this class, you know a lot of stuff. You got to give yourself credit. And it's not just knowing what bone is what. It's really starting to apply things a little bit. That's my goal, at least. Otherwise, that's my reason why I teach this thing. But I want you to study and say, like, how can I support what's going on with this problem here? Like, I just had this finger, and it's an infection. Where you go like, oh, the doctor will take care of it. But I try to make sure I get to, it's a Kaiser. I try to make sure I get to this doctor once a week, once a day, or every other day, and hopefully a different doctor. So I get all these different inputs from different people what to do. Because the emergency room doctor said, oh, you went to the pool. That was probably helpful. And I'm like, I'm not so sure about that. Well, the chlorine, I'm like, And everybody else was like, no, that was a problem. That was probably the problem where the stuff came in. And I don't want to say, oh, one was wrong or one was not. Oh, I hate that end. It's not the way it's supposed to work. You're supposed to be thinking about your own body as much as possible. And so that's what I wanted to do, is that third question is, because I had a student that came and missed the test, and she missed it because she went to the emergency room with her kid who had asthma. I said, oh, good. What did the doctor do at the emergency room? And he says, like, well, I gave him albuterol, an inhaler. It's like, did they also talk about maybe, I don't know, playing next to the freeway? Are you doing any of that? Or how about your milk intake, your sort of phlegm-producing food intake, like bread stuff, which, it's very common in kids that they eat that stuff. I last checked, especially in our society. And they didn't talk about none of that. And so you're doing which is where I kind of differentiate a little bit the Western and Eastern philosophical approach of medicine, not where it's coming from anymore. But it's more like, the going to the emergency room, they're going to say, like, oh, you got an attack. Oh, let's give you an albuterol. That's great. Then the attack goes down. And so they've done their job, which is true, right? That's sort of the Western approach. We find what's wrong. We try to fix it, try to cut it out. But we're looking like everything is kind of a virus in that respect. And it's not really the truth. We have a lot of long-term problems, like diabetes or so, where we have a lot of input that we can bring from the outside that we also have to or can contribute in the pathology process. That's more the like, how can we improve function of what we already have in our system? And that's not really how our Western approach is set up. It's more an emergency approach when we're already getting to that stage, and then how can we fix it? That's more kind of on us. Or I often tell people, get yourself into a good acupuncturist once every 10 years and get that system figured out as well as possible, and get it tuned up and make sure you're working on that front well, because that's a completely different way of looking at things. And it's been around forever. It's not like, people say, oh, does acupuncture work? I'm like, you think 5,000 years later, people still think it's going to work when it doesn't work? I don't think so. I think it will work when it's been around that long. I don't think everybody else is kind of foolish except me. It's like, so that's, or chiropractic too, for what I do. And I know a lot of chiropractics, like, oh my God, do not please go to that kind of crackerjacker. People send me videos of these, like, people, they put a towel and then they go, yank on their neck. I'm like, no, please don't do that. You know, not every tissue has the same pullability, and you know, the spinal cord is not that pullable now. You know, and all the video people are 20 years old, of course, and a 20-year-old you can do that, but not when it's like my body anymore. I don't know where I was going, but anyway, that Eastern sort of more functionally improving a system, I think is good for many things. We do a lot of that posture for back, you know, the injury prevention for the movement apparatus. But let's now also do a little more of that or dive into some of the other pathologies. And so the third person, I want to research a little bit of that question. And then we all come together, bring all our research. Each has 5 different sources or so. And we can have meetings. I can be of service too and make sure you guys know what's going on. You can talk to me. We can have more interactions here, meet on Zoom if you want. And then you're gonna make a presentation out of what you found. And so if you haven't learned that yet, you'll learn a little bit about making a presentation. Mostly it's a PowerPoint for people or a Google slide or so, which works pretty well, especially if we're doing it online. And then I originally wanted to do brochures, and then we talk about the brochure. And so digital brochures, they had this program called Sway from Microsoft. And then everybody would get each other's brochure on the phone, and then you meet somebody and says, oh, my kid has asthma. And you say like, oh, look, I got something from my class. And and so we have everybody has a little elevator speech about a pathology, which brings me sort of to the project as a whole, why I did it, right? So we get more knowledge, we give each other more knowledge by every group does something different, and then we share it. But I also want the presentation be short. I want you give us an elevator speech, and that's really, really difficult. Bring it to the essence of what you want to talk about, and every member should have about a 2 to 3 minute talk, not more than that. And so then, you know, when we make the presentation, you're going to share with me and I'm going to give you feedback and we go back and forth a little bit. And generally it's going to be like, you know, use less words, more bullet points, not whole sentences, because you don't want to read a sentence in a presentation. That's like everybody going to fall asleep in 1 second. And use more pictures, because you can describe a picture in a presentation and everybody will be actually seeing a picture, not words, because that's much more stimulating for the brain to see a picture and more understandable than see a word. And even emojis, you know, even if like somebody sits on a desk and you can see sitting on a desk, you put a picture with a desk. Even that is much easier to talk about or the brain to absorb when we are on the listening end of things. And so we work a little bit with that, and then at the end we tie it together and you make a group presentation. Most of the time we make it on Zoom. We can also come into the classroom on Monday night and do some of that. If you guys want to be in the class doing it, if you want, we can put in an extra Monday somewhere and just have presentations. It's, you know, we're going back into physical space, and so I want to give you both opportunities. So some Zoom works good, and for some it's a little harder to do it on Zoom. And then lastly, we share with each other our 10-minute presentations, and we look at a few of them that interest us and give each other feedback. First, learn something from it, but then also look at it a little critically and say like, hey, that was great. Now, if you slow down the talking a little bit, which is probably what you're all telling me, I understand it better. And so give you the positive sort of help for the next time to make it better and improve on it. And that sort of then at the end is when we finish the semester. So that'll be December at that point. All right. So that's sort of the overview. Does that make sense? Is that kind of, what are you thinking about that? Oh, we got some chats. Any thoughts? Nobody? Hello. Did everybody leave? No,
It sounds good.
Okay. So
Yeah,
it's not,
that sounds
you
good.
understand what I'm trying to do?
Yeah.
Yeah.
All right. So that's really what we're starting. So first things first. First, you do that group again, please. I'm so sorry. And get yourself back into the groups. I'm going to delete the other ones.
Okay.
Sure.
Yeah, because they're still there.
No, I know, because I like, oh my God, what I was grading the groups. I'm like, why is there 12 people in a group? And I was walking home with my dog and he didn't want to walk. I'm like, something was wrong. So I was focused on grading the other stuff before. So yeah, first that, and then start talking about what pathology you want to do, and so there's no, in terms of rush, it's not really, if we get those two done before next Monday, we're in good shape. So what pathology, who's doing what stuff, and which groups to join. And then next week we can start with the research part. All right. And then the other thing we're doing this week is the exam. Any last thoughts on that? Or you guys are good with that? It's open book. Make sure you have your material organized. All right. It's going to open up pretty soon. I'm going to open it up after the class. Tomorrow morning at midnight. It's 54 questions. You got 3 hours. So you have plenty.
Is it due tomorrow?
Huh?
When is it due?
On the 22nd.
Okay, I see. I got it.
When is that? I think that's Sunday, right? Or what is that? When is the 22nd? I forgot. Make sure.
Sunday?
Yeah, so you don't have to take
Sunday.
Yeah, you don't have to take it now. You got plenty of time to take it. Again, maybe before you take it, watch the study sessions that I did to just sort of, unless you had enough, At some point you reach saturation point and then you just need to do it. But I also, the drills that I send out, watch those if you want to make yourself be more assured in it. And then you have till Sunday to take that exam. And if anything comes up, questions or challenges, please reach out. Don't be a stranger. I'm here to help you. All right. This exams is what you can only take one time. Those are the ones you can take multiple times. And on this one, what you do is you write in, you have your list. If you don't have your list, make sure you text me so I can give you the list, but you can also find the list again if you need it in the review on the list for testable terms. Also, these review videos are good to watch. This might be actually the best thing to watch before the exam if you want to get another session of a surety, because I go through every term, maybe a few more than on the list. I've done this a while back, but every term is covered in about, I don't know, like 45 minutes of material or something like that. All right. So that might be an interesting last drill for you guys just to check. Or I do the ones in class. But then this is where you get the list. But it shouldn't be that. It usually works pretty all right. Oh, the other thing I need to make sure is when you finish the test and it says, oh, you got only 35 points, you just don't look at that, because I have to manually go through the whole test and make sure all the misspellings are giving you credits. Of course, the less of them you have, the easier for me, because that is sometimes a little hard to go through the test. So give me a few days to go through it, because all of a sudden I get 20 tests to grade, and each one can take me up to 15, 20 minutes, depending on how detailed it is. But don't be alarmed by the lower score. Nobody ever got lower points, but everybody gets more points on it, depending on how it goes. So just a caveat. And then this week, we also start with the heart and blood vessels and lymphatic. So yes, go ahead.
Yeah, in the student version of this, I don't see week 9 there.
Oh, shoot.
Am I missing something, or?
No, I'm missing something.
Not there.
Oh, that was me. My bad. Oh my God, I had it on my list. I totally forgot. Now you should see. Almost. Yeah. My bad. All right, now you should see.
Yeah, because I thought, oh, maybe we don't have anything, just the test.
No. It's on my. It's what happens. I go to the classroom, I make all these videos, and then I burn out and I lose my mind for a few days. It's what happens when I don't have a 9-to-5 job. Just keep working at night. So now it's open, but we're gonna go into the heart. We're gonna start the last section. So once you're done the test, or parallel, depending on how you feel, but don't just blow up the test and then stuff more stuff into your head, and then it gets confused. I need to focus. But then we get into the heart, we get into the blood vessels, into the blood, into the immune system, into the brain, and all the other stuff till the end of the semester. And when we get into that, one thing that I want to tell you from the beginning is, and I also, of course, should open that, that would be helpful. In test 3, at the end, in the review, not that. In the review, you have a really extensive test review. And it's attached in here. I want you to go and start working with that as soon as you get to that material, because on it are all the bullet points that I want you to know for the test 3. Because the test 3 is going to be partly the written like test 1 and then partly labeling like test 2. And all the written questions are on 4 or 5 pages of test review of all the material. Because what we can do that way then is you can go through the material, do the questions of the material, and then look at this list of testable stuff that I want you to know for the test for sure, and make sure you understand that. And then the material gets sort of consolidated, because the last section of the test is quite long. It's quite a long period. And what I don't want to miss time to just take tests left and right. I'd rather have us go through the material and have a good time learning. And this way we can sort of have it be very structured. And it usually works out great. Usually the last test, people do fantastic on. So but I want to make sure I start talking about that every week early on. That way the concept, sort of how I like it done, or what I think is the easiest way for you guys to get the most bang for your buck, is kind of understood, because it's a little bit different than what others do. Anything else?
So is that submission gonna be like late, considered as a late submission with the group, or?
No, don't worry about that. That's all background stuff. Yeah.
All right.
I mean, generally with the lates, I leave the lates. I always leave them there till the end, because otherwise I'm going nuts. We're just trying to change everything. But if the late makes a difference in your grade, they are going to come out.
Okay.
So don't worry about none of that at all. All right.
Thank you.
The lates are minimalistic, and they help most of us be enough on track that not people end up going all over the place, and then I lose people in the process because they never hand anything in if I don't have any point value to it. And obviously, if you're always 10 days late and you don't pass the test, we have a talking point for each other. But most of the time, the late's not impactful on your grade. Okay? Good. All right. I'm good. Are you all right?